So absolutely, yeah, our allied health professions are an invaluable part of our team, 14 different professions, and I think many of those are not unseen but actually unsung in terms of our wider workforce. And for me it's really important that we value every individual within that workforce. What we see every day and actually the impact that they have on our patients, patient flow, patient outcomes, patient care is immense, and I think the one area that we see and don't celebrate anywhere enough with allied health professions is the lateral way of thinking and the real way that we can use our colleagues to really transform the way that we provide high quality care going forward.
I'm a speech and language therapist. We've got a team of therapists that work across the hospital here, and we help patients who've got difficulties with eating and drinking and swallowing, as well as patients who have difficulty with communication. We can see them across the whole kind of range of services within the hospital. So I work in intensive care, so seeing patients that are critically ill, whether that's from a critical illness, a traumatic brain injury, a traumatic injury of some variety. My specific role is working with those patients when they come into intensive care, helping patients get back to talking, helping patients getting back to eating and drinking.
So as a rotational physiotherapist, we rotate throughout different areas of the hospital. So this can be from different wards to ICU, and we jump in and out of patients' journeys to facilitate their goals and progress them in ways that they want to progress towards those goals through adapting and tailoring physiotherapy plans to their physical needs.
So I respond on vehicles to see patients, and also responsible for a team of 25 clinicians and support them in them giving patient care. Additionally, when things get busy at the hospitals, I will come over and liaise and collaborate with our emergency department colleagues, try and get our patients offloaded so we can get back out into the community and provide patient care in the community.
So we will be working with the doctors to look at their medication to see if there's any side effect that can mitigate. For example, if a patient has a high risk of falls, we may look at medication that reduce that if they've got a medical problem. We also look at how that medical aspect can affect their functional baseline. So for example, when they used to be able to do washing and dressing like everyone probably would take granted for, we want to make sure that they can do it at home as well.
So I'm a diagnostic radiographer and I work in X-ray. So we work across a lot of different departments in the hospital. So we work in the emergency department, we work with inpatients, outpatients, and those coming from GPs as well, and we also work with theatres. So it's our job to be able to provide accurate and diagnostic images that doctors and other clinicians can use to diagnose the patients and be able to plan treatments for their patients.
So as a therapeutic radiographer, we are providing radiotherapy treatment to patients that have had a cancer diagnosis. However, we do provide treatment for people who have been given a benign non-cancerous diagnosis as well. Now, to do that, we use high energy X-rays and provide a targeted treatment. So sometimes we can treat really, really tiny areas with such accuracy, like sub-millimetre. It's really quite amazing what we can do. I'm involved in the planning and delivery of that. However, I do work as a wider team. And radiotherapy itself can be used in conjunction with other treatment modalities. So it can be used with surgery, chemotherapy, immunotherapy, or just on its own. And to do that, we use a linear accelerator called a LINAC for short.
ODP, we always abbreviate, no one gets it, including patients. So we enlarge on that, it stands for Operating Department Practitioner. We initially trained, in my day it was 2 years, and we cover all aspects within theatres of helping the anaesthetist, assisting in the anaesthetic room. That would be, we in theory scrub up, or we do scrub for surgery and assist with surgery with the surgeons. And then we eventually extended or migrated slowly into the recovery area where we look after the post-op patients.
Yes, the role my profession plays is a difficult question to answer because it's really varied. It's one of the really interesting things about dietetics. They can say, yeah, I'm a dietitian, but within that's a huge umbrella term for so many different roles. But the pivotal point of that is all around nutrition. And dietetics is about understanding nutrition in a sense of its effect around health, well-being, and its relationship to disease and injury and illness. And it's one of the really interesting things, one of the exciting things about dietetics, and it's in everything. So working in an acute hospital, my focus is all around acute care, and it's in everything we do. So if we optimise nutrition, people just have better outcomes.
I've always enjoyed helping people, and I think that help becomes more valuable when it's seeing people at different stages of their journey. And I think being able to help people with their goals, and those goals might change. They might be something that's something short term or long term, and being able to help them with those goals throughout different areas of their hospital journey, through maybe just helping them stand up or sit on the edge of the bed for the first time, or it could be something a little bit different, to maybe walking outside or walking with a new piece of equipment, or more in-depth things. If you're in an outpatient situation, it might be that they want to get back to sport and they want to get back to a high level sport, or they just want to be able to go about and get to their work more easily, or take out their occupation more easily. So it's, I think, seeing those different areas and then working out how you can best help them to achieve those goals is something that I enjoy doing. It's challenging but rewarding.
Doing a role, doing a job that is helping other people is why I do it. Is to kind of help those that need it, to feel like I'm doing a job or a role that's making a difference to someone.
So I think it's that, just wanting to be able to provide the best care that we can for our patients, and that's why we work quite closely with the emergency department and the hospital, to try and make sure that we're seeing our patients in the community and supporting each other as healthcare professionals.
It doesn't happen often that people come back, because despite how well we hope radiotherapy goes for them and that they have a relatively enjoyable time, they don't always necessarily want to revisit it. But I think just the majority of people having a smile on their face when they finish treatment, when they ring the bell, because there's a bell in the department for when people finish treatment that they ring, and hearing us clap and cheer all around the department, I'm hoping that in itself helps patients with the journey.
I'm very proud of what I do. I say we see a lot of different patients from a lot of different backgrounds. And I say we see them at all stages of their journey, so whether they've just come in through the emergency department or from their GP, and we also see them at things like their follow-up clinics. So they may come up for follow-ups if they have had a break, or if they've had a chest infection, they might come up for follow-up imaging as well, so we'll see them at that part of their journey as well.
And I think for me, it's an absolute huge thank you on behalf of myself as the Chief Nurse in Integrated Professions, but from the wider exec team and the Trust Board, to really take time to reflect on the impact that every individual has on patient care and on the wider team within University Hospitals Plymouth, but also a huge thank you on behalf of all of us in terms of the impacts that you have on our patients every day.